There we go. So we are live. So let's begin again with the disclaimer. The views and opinions expressed in this podcast are those of the hosts and their guests and do not necessarily reflect the official policy or position of any institution, nor is an endorsement of any agency or organization. Any views or opinions are not intended to malign any religion, ethnic group, club, organization, company, or individuals, and respect the fact that people's views and opinions are subject to change. So, welcome back to another week and our sixth episode of Talk Public Health. If you're joining us live on YouTube or you're listening to a recording of this episode, Naomi and I, we're glad to have you back. And just for the month of May, we explained in our last episode that we were doing these bi-weekly podcasts as Naomi and I try to wrap up our dissertations, which are due next week. Thank God. But for our seventh episode, which will be the next one, will be live June 1st, and we'll continue to do weekly episodes. But before we begin, I think you know the drill. For those of you joining us live on YouTube, hit the subscribe button, click the notification bell so that you can be aware of when we post an episode and upload new content.
Yeah, super excited that the dissertation is almost over. But of course, please and please like and follow our other social media channels. So we have Facebook, Instagram, Twitter, and SoundCloud for those of you that like to just listen to the audio. And we have our links posted in the description below. So yes, we look forward to seeing you subscribe. And what are we tackling this week? I like to be the bearer of good news.
Mhm.
Today, we will be looking at the forum that concerns our profession globally. So, moving from public health to global health, international health, all related to health. And we will be looking at the World Health Assembly, which is currently happening now. And it started on Monday, the 20th of May, in Geneva, and it will continue until the 28th of May. That's a long, long week and a half, I
Mhm.
think. So this
Mhm.
means that like all stakeholders, actors that are working with health, interested in health, involved with health, are currently in Geneva discussing health issues, debating, and trying to figure out everything that concerns health under the big, of course, agenda of universal health coverage, UHC, which we are all familiar with. So happening for the 72nd time. I think Charles and I had a long debate on how it's 72nd because it started in
Mhm.
48, but then
Yeah.
we got our maths right
Yeah.
finally. So yes, the 72nd time, we will be discussing the challenges and opportunities of the World Health Assembly. And now we'll delve into the first question.
Okay. So yeah, the first question is giving you a bit of an overview and discussing what is the idealistic view that people have about the WHA. So just as we said, as we ended up doing some research, the first WHA it was held, that WHA being World Health Assembly. We're gonna say that a few times. So you're gonna hear WHO and then you're gonna hear WHA. WHA is the World Health Assembly. Just letting you know. Okay. The first WHA was held in 1948, just 2.5 months after the WHO was formed.
Mhm.
So at that time, there were only 48 member states with representatives from about 46 of them present. The budget for the first assembly itself was 6.5 million, and that was pretty significant when you consider back in the day compared against the actual WHO's annual operating budget at the
Mhm.
time. And the first director general was Dr. Brock Chisholm from Canada. For those of you who don't know, he's the person who helped to define health as,
Mhm.
quote, the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Which I think, if you've done any public health class, it has probably been quoted
I think
so many
I
times.
think a lot of us just know it by heart now. It's like, yeah,
Right?
yeah.
And a funny thing, even back then, the conspiracy theorists were about who were saying that the WHO was founded to achieve a one world government and to remove from the minds of men individualism and their loyalty to traditions and national
Yeah,
identification.
I thought that was very funny. Like, why would they will think that? But yeah, of course,
Right,
we have.
right, and it's sad because it's still kind of happening today, right?
Mhm. Yeah.
But But what's happened since 1948 to now? You have over 190 member states and tons of non-state actors, including this like creation of a framework with the non-state actors FENSA, which we'll talk about a little bit in this particular podcast. And FENSA was created to engage with non-state actors in a view of their significant role to global health and for the advancement and promotion of public health and to encourage non-state actors to use their activities to help protect and promote public health. And guess what? The thing about it is, the main principles were that I am that observers and oh God Lord, we're a bit lost here right now. It's
Yes,
fine. It's a
I would
Saturday,
have anyways.
right?
Like
It's fine. It's fine. It's fine.
they had
What
like
you need to know is that there are a lot of non-state actors, there's a lot of member states. They've all come together to try and address public health. And there's a multi-million dollar budget that the WHO currently has, and the World Health Assembly comes together to really address some huge issues for global health. So this is when we get into this whole thing of what are the idealistic views that we have about the World Health Assembly. I don't know, Naomi, what do you think?
yeah, I will start with you getting lost with Fencer. I think the whole world is lost with the Fencer thing because also it's okay. And that's one of the reasons why we mention it because it's there as an ideal framework, but then like how was it brought about, what principles are behind it, and that kind of thing makes you will be a bit lost when you get into it, and we'll attach it in the description so you could have a lot of time to play around with it and see what Fencer is. And but in talking about the idealistic views, I would say I happened to be present in the WHA, and I would say my mindset was like, this is a place for like a strong and decisive decision making, and this is how it has been coined that this is the fora to address health issues, and it's like this place where everybody comes from everywhere to give their stands, to talk about how they will challenge or how they will address a certain health challenge and the topics that have been mentioned. I think everything that is an issue in health has actually been discussed. And I also see, given the dynamics and different stakeholders there, we have like civil society presence, policymakers, ministries of health. So maybe there's also a knowledge translation platform, like learning how to move out of our public health lingua franca and speech settings to talking with people from different sectors and trying to translate our knowledge for them to understand what exactly are these people ranting about with health.
Yes,
And
yes,
this is,
yes.
this is this is how I think the idealistic view of the WHA is, and also it's a space of inspiration because you see a lot of young people, like also a lot of people that are passionate about fighting for health, coming to talk about like the issues that concern them, like be it mental health, be it exclusion, and be it like even I think this year there were some side events of the indigenous population talking about the health issues that concern them. So
Hmm.
it's a place of like really coming to discuss what health issue is your
Exactly.
story,
Exactly.
and I think also for us that are really big on WHO simulations is also a really nice atmosphere to see. Oh yeah, so this is actually what we're trying to share with students to encourage their diplomacy and advocacy skills, which is really necessary when you study public health. So yeah,
Yep.
I would say like from my perspective, this were the general idealistic views of WHO, and I think for everybody else so as a whole. And Charles, what other views do you have idealistic?
Yeah, yeah, I would definitely say that I would have seen Geneva and the WHA as a place for really like trying to tackle the hard issues. The things that we go through studying are like masters or like PhDs for to try and create a better world. And additionally, just bringing from like practice, no, from study and practice into actual like real change that can be done. And I agree, like it's a really really great place to because if you're at the forefront of like global health issues, this is a place where so many people are like coming together. Um, so I would have seen it as a place to like inspire you,
Mhm.
right? Inspire you to try and like address priority issues for an upcoming year or for upcoming meetings or whatnot. Um, but we know that sometimes the idealism doesn't always align with the realities. So I think that this kind of like segues us well into our next question, which I'll let you take over, Naomi.
Yeah, so I think like to put more emphasis of the what are the actual realities. I think that was what we'll be looking at for the second question. So we are actually looking at the major discussions right now. Like given this whole fora where everybody is coming to discuss, the WHO seen as this ideal organization that is just fighting back and forward. For to tackle health issues, I think one of the first thing we would look at is the major discussions, which was about like the WHO reforms and the investment case of the WHO. I really find this word like WHO investment case a bit, trying to sell health to people. But yeah,
Mm-hmm.
we'll discuss about that later. So yeah, the general discussions this time about managing the programs of WHO and both regional health quarters and country offices, and also like the price tag. I think in code we could say the hefty price tag that's attached to delivering and achieving these good outcomes for the reform. So, what would we like to emphasize is that over the past over the past years, the WHO has been trying to see how they could make their work more I would say better, how they would enhance their, I would say, organizational practices and trying to achieve better health for the globe in general. And now they came up with a strategic plan for the next 5 years, on which they will need about $14 billion, according to the investment case that was released in September last year. And I think the investment case was talking about how the WHO would work on its triple billion goal. So that is protecting 1 billion more people from health emergencies, reaching another 1 billion people with health coverage, and improving the health and well-being of 1 billion people. So that is like the 1 billion, 1 billion, 1 billion, triple billion, right? And approximately the funding they thought like this 14 billion will be divided into 10 billion for the base case, and then humanitarian aid will take about 2.5 billion and another 1.6 billion for polio eradication. And this says that these are the top priorities in terms of like what the WHO will be looking at. And this also was like talking about how they could increase investment in country capacity. So there was about, let's say, $600 million towards it. And as you could see, it's all about money. So it's like the WHO just talking about how, oh, we have this perfect strategy on how to make health better. But yes, we need the money for that. And you could see like how health is now really concerned with funding, and you will think that a huge organization like this would not have a problem with raising 14 billion, and especially with the fact that they have like ambitious targets of like resource mobilization and trying to build capacity around health. And even with donors, like trying to fund the WHO over the years, with member states paying their what I say, contributions to the
Mm-hmm.
WHO. I wonder why this money aspect is like the main thing that I would see being pushed, for the reform. It's always about how there's no enough funding in the WHO. And Charles, what do you think about this? Like a huge organization like this struggling to fund their targets.
Yeah, I think I've like heard people who outright say that, if you plan to make money, don't move into public health. And uh, and that's kind of really really disheartening when you really like recognize that the impact of like good or poor health on people and on countries can play a significant role on how well a country does economically as well. When you like think about $14 billion, which WHO requires for achieving this like for these triple billion goals, versus, I mean, not knocking it, like the $2 billion that got raised for Notre Dame in less than 48 hours.
Yeah.
Like it kind of makes you feel as though there's some really warped, in my opinion, which we said is an opinion, what what priorities for people in terms of like what is considered necessary, what is considered to be important
Yeah.
for addressing people, and healthcare is one of them,
Yeah.
right?
Yeah.
And I like, I don't know, Naomi, if there's anything else that you wanted to like add to that, but like that's how I felt on that particular area or topic.
Yeah, and also I think one of the things that for me was alarming was the fact that we had to present health as an investment case, like telling countries that, oh yeah, for every dollar you invest, you would have this return. Like I felt like this is, now I'm talking the language of entrepreneurs, which I don't, I'm particularly not sure how to take this. Like,
Hmm.
shouldn't people like see health as a human right? Why should
Hmm.
we present it in a way that countries have to believe that, oh yeah, if you invest in universal health coverage, then you will get a return for it? Shouldn't you just be concerned of how people in your country should have access to good health for you? Like, because there's just yeah, so that I think is alarming for me in terms of like this presentation. But
Yeah,
also I think maybe the WHO saw that this is maybe the best way people would understand the language of
yeah,
funding, and especially because there are shocks with like donors withdrawing their funding from the WHO and like engaging with other things. So maybe this barrier or this big gap of funding made the WHO say, "Oh yeah, maybe we need to change our language,"
okay.
and but then also this comes with the perks of like the philanthro-capitalism and private entities now coming into like who does now the WHO's agenda gets dictated by who brings money into it. For example, I think
Yeah,
I was reading and I see that about 30% of the funding of the WHO is on polio
yeah,
because the people funding want polio to be eradicated. And
yeah.
this means that if polio is eradicated, the WHO does not have like 30% of their funding. So how
And it's an
sustainable is this? Like
and
why
it's a
are countries allowing? I would say WHO should be sponsored by countries, and why,
yes.
if not, like why are countries allowing other? It's not bad for donors to do it, but why are they like earmarking this fund and saying you have to spend it on particular things?
Yes,
So
I think that this is a like a good like question to like answer, because like I was also reading up around the like 30% earmark for the eradication of polio, and a lot of the surveillance and like preparation functions of the WHO comes out of that. And so what happens when you eradicate polio? How are you going to get money for surveillance of other type of like non communicable diseases that also can be eliminated via vaccines and like other issues, right? And like this whole like embedding of the philanthro capitalists and these private entities into the WHO, I mean, it almost seems like the clash between like health economics versus like health as a human right
mhm,
discourses bashing against each other. I know that Tedros, he recently appointed Ray Chambers, who worked with the MDGs to try and like raise money, but now he's a WHO advocate for trying to raise the profile of the organization and trying to, I guess, mobilize more resources towards it. And the agency is, and the WHO is also trying to figure out how will it get more private sector financing without compromising the organization's integrity. And that raises a lot of issues about conflict of interest. Yeah, I saw you trying to speak, Naomi.
yeah.
Yeah,
No, yeah, for me this was very interesting because I kept asking like, okay, for example, like we're trying to get some particular private entities into it, but then we're excluding others. So what is the rationale behind it? And I think like even with the realization of FENSA, which is now like the huge like engagement for non-state actors, there's a huge rationale, like engagement criteria and principles on the inclusion of like private entities or other non-stakeholders. But I feel that maybe I agree with Tedros on trying to convince countries more to invest in the work of the WHO, because if countries are giving money to the WHO that are not earmarked and they are like clean and clear that they should do the work they do, then
Mhm.
maybe the WHO will not be trying to talk to like a lot of other donors that kind of give money but somehow try to influence the agenda, I would
Mhm.
say. And yeah, so maybe countries, I know even like the big influence of the global not big donors are also there, because some of the countries that are donating are also like top countries. But I feel there is more flexibility with countries donating to the WHO than with private entity. And I'm not saying that the WHO should not work with, of course, we need to engage with other stakeholders, but I think we should be careful on how much money we receive from them, because, of course,
Yeah.
then they will tell us what to do with the money, you know?
Yeah. Yeah. That is very true, and I think that like this has been like quite clear in terms of like seeing like the roles of like big countries like Germany and the US
Hmm.
and their investments. Uh, um, um, I think that Germany, we were both at the World Health Summit
Yeah.
where they like had donated about over 115 million euros, and they said that it was in the form of voluntary contributions, but not all of it is flexible. Sorry, yes, not all of it is earmarked. Some of it is flexible, and so that's good. But then you like think about like one of the big arguments I heard coming out of the WHA this year was that there was a resolution around like market transparency around like human clinical trials, and Germany was pushing back against the resolution because there's a lot of big companies in Germany that do pharmaceutical trials.
Definitely.
So like, do we not believe that investment? I mean, I'm not saying it, but like when you start start investing so much more money, you don't think that you get a bit more clout in the diplomacy arena, right? And like we don't even have to talk about the U.S. Like the U.S. clearly has like
Like of course,
impacted a lot.
like the US also like cutting funding from its like major like donor major UN organizations, I think, especially with the whole like Trump agenda, and
Hmm.
seeing. So this has actually really affected the areas of like commercial determinants of health, like sexual and reproductive health, and breastfeeding. So like this huge donor, of course, cutting funding across programs that affect these areas of health would also mean that like we don't have enough funding to address them, which means that other countries have to step up to provide funding for this. But then it goes back to the question that why do we have to actually depend on major donors, I think, and then there should be a better way to fund the WHO and its activities, and maybe there should be new funding schemes, which is
Hmm.
something the WHO should be thinking about, I guess, as well, than
Hmm.
just holding on to countries and like big countries, like all countries should be involved, and holding on to like private entities. I think like the Bill and Melinda Gates, for example, is one of the top second donor, even more than some countries for WHO, and that
Hmm.
says a lot. So I would say, yeah, when you start talking about the issues, there is but enough time to cover them, and then maybe we could move to the third question, which also looks at some realities and conflicts between the realities and idealism, which we already started discussing. But yeah,
Yeah.
we'll proceed to that.
Exactly. Yep. Just like taking note of our time, we will manage to finish. But there are some conflicts that definitely get created. First thing that you need to know with WHO changing its like going for this triple billion target, it's actually managed to like change its budgetary structure. So what does this mean, right? If you've ever looked at how like budgets in health are like categorized, there's now no delineation between communicable diseases and non-communicable diseases.
Mhm.
And this is a big like sticking issues for both like WHO country offices and for other member states because how do you begin to make comparisons in ensuring that like these areas are being adequately addressed. And then there's also the like new WHO Academy and the health department, digital health department. People are trying to figure out exactly how will these be funded or like how will these be governed. And it kind of like, and then with we've already started like talking about this with the philanthro capitalists and the pharmaceutical companies getting involved. It kind of makes it feel like a bit of a marketplace
Mhm.
rather than like a decision making like venue, right?
Mhm.
And I like hate to like put it or like frame it in that light, but you have this clash where donors, they want to be recognized for their contributions
Mhm.
and the collaboration, and you have organizations like WHO or other member states who are fighting to try and get people to like fund me. We need this, right? And so it comes across as a marketplace for trying to get money.
Exactly, like what struck me out was like when I was in the WHA this year, like I was sitting in the plenary room and I was like, what? Where is everybody? So like I could see how people prioritize going to the side events that are created by these non-state actors than being in the plenary itself, which says a lot about how the WHO says, oh yeah, like the NSA, it's like that's the non-state actors don't have much like voting rights, but you could see how they're clearly influencing the event. Like I was like, you go to like events by maybe a pharma or industry, and then you see like there's no even sitting place, and then you come back to the plenary, and you're like, what? People are actually so only countries. Delegates are actually there, and even some, not all. Like it was surprising for me that everybody else is like trying to discuss with the actors that are of more importance to them. So that's why I think strikingly for me, this is a bit of like a marketplace. Like, what can I give you? What can you give me? And
Hmm.
I'm not particularly sure what kind of what are we portraying with that. I would say
Yeah,
I'm still a bit like trying to reflect and understand what is actually going on in like the health sphere with this kind of like
yeah,
and I think the same thing we saw in the WHS, Charles, like when we were there, it was
yeah.
like similar. It's just that with the WHA now it's more like a countries have more, but by WHS, the World Health Summit, the WHS is like more of the industry, I would say.
Yeah, no, no, definitely. I agree with that 100%.
Yeah, so yeah, I would say like this maybe there is a maybe we cannot of course we cannot exclude like all the actors, but maybe there's a better way to be like more of us. Like that's, I'm not saying like me, I don't work for any ministry, but
Yes.
I mean more of like the health people dictating and not like falling into that. Because I was at one event and then there was this like, oh yeah, we should be this comment like we should be thinking about solutions that will, or like interventions that will also profit us and also bring health as well. And I was like, okay, this is and you could see those dynamics or also like, but the one thing that struck me out was the fact that I was at a session which was mentioned that we should try to more like push towards achieving health as a social so using the social insurance structure like the NHS
Yeah,
instead of the American like model, which
yeah,
is about like the markets and
yeah.
like trying to make profit. And I think this really struck me out that there was like people considering like, okay, like they're like, if you see your country getting hit by the American model, like try and like save them from that, and let's
Yes,
do more of like NHS. And I think like in those kind of discussions also there are good benefits to them, but generally like everybody's trying to get what is best for them. So I would
exactly.
say some of the things I that also struck me out was freezing people out of the dialogue. So for example, how I mentioned that you could clearly see the influence of non-state actors. But another thing that struck me was that the WHO itself, like claiming to have like discussions now with food industries and like alcohol, but somehow tobacco is not there. And then I'm like, what is the rationale of including these people and not including the others? And I'm trying to still explore why this has been done, and or
Hmm.
even the partners meeting that was held now with the whole partnership agenda, where certain like we still don't know who was invited or not, but like certain particular interest groups or like philanthropists or like industries that could give money was like invited, but then others were not. So you could see like the dynamics. So like, yeah, Charles, what else like you see? Like,
Yeah. Well, I think that some of the like conflicts can also come in internally, right? Where you feel a bit of a disillusionment between seeing like how things are like being carried out versus like what you may have studied. And I feel as though like
yeah,
um I remember and like maybe some people didn't get it, but I think one of the like best classes that I remember having was with key issues of a global health. To
yeah,
me, because of what our professor Julie Berlin said, which was that health is political,
yeah,
right?
mm,
And like it really touched into like how different actors outside of health
yeah,
really play such a big role in it. And I think that a lot of people that kind of like you saw almost like something break in their mind, and they're just like, wait, I don't want to be involved in politics.
yeah,
But
yeah,
the reality is that when you define something as public health,
yeah,
then there's private health. So you're taking a position on something that is inherently political,
yeah,
right? And so I think that that's main thing there. And also, I think maybe to like wrap up, seeing how there's fragmentation
mm,
occurring between organizations that like tackle health rules and whether or not we're going to continue to see a fracturing off of different organizations to
mm,
address health issues that the WHO should be doing
yeah,
because they don't have the money
mm-hmm,
or the capacity to be able to carry us out.
yeah,
And like there's some like good things that I've carried out, like some like with UN AIDS and with Gavi, although there's like pros and cons to these agencies.
of course.
And maybe we can discuss those in a later show.
Yeah,
Um,
I really,
um,
I really think that this issue, I think we need to like discuss it even at another episode after the end of the WHA, because
yeah.
what really struck out for me, Charles, what you said, this disillusionment. I think like schools of public health should somehow encourage like their students to actually go to these events, because in reality this is what you have to deal with. And if we keep staying in our maybe academic lens and like research lens and thinking that, oh yeah, like politics is for the other people, I don't think things are going to change. Like we need to somehow embrace politics, because
Hmm.
as to strike out as well, like this the statement also by Simon Rushton, which was also a lecturer in key issues, that said like there is nothing more political as well than health. And I think the synergy with him and Julie's speech that I think changed my perspective in understanding how we could best tackle, because it's really like it's really political, you know. And
Yep.
we should be really thinking of how maybe to speak a language that politicians understand, or get them to understand what we are saying, to be able
Hmm.
to like, or not only politicians, like even the industry now that is like becoming an influence to health, to make them understand that health should be a human right, you know. And
Hmm.
how do we then get to that point that everybody is concerned with universal health coverage, be it profit makers, being politicians, and everything. Let them see like universal health coverage should be at the peak of their agenda. And I think that that
Hmm.
is what the WHO is trying to get to. And I think that is what the whole like globally we should try to aim towards.
Yes.
And yeah, that was
So,
from my side.
so now we wrap up.
Exactly.
So we don't have any question for you all this week for you to like reflect on, other than like for you to go ahead and learn a bit more about the WHA. We placed some like links in the description about what you need to know about the WHA. And if there's any questions or like queries that you have about it, let us know in our comments or by like sharing this video and asking us. And one quote that I want to like end on is one from Tedros that says that there shouldn't be any us versus them
Hmm.
in health because we've all committed to trying to achieve Sustainable Development Goal number 3,
Yes.
which is health for all.
Hmm.
And so I think that really like resonates with me and kind of like ties into how we end every episode, which
Exactly.
is that there's only you, me, and all of us on this planet.
Exactly.
So try to show some empathy and care for each other.
Yeah, and
So
remember, that all roads should lead to universal health coverage.
There we go. There we go.
Right, bye.
So until next week, bye bye.